So our part of the public health infrastructure grant really allowed us to do deeper analysis of the public health workforce to better understand local capacity that could then be applied to other geospatial analysis that we were doing with the support of other fund structures. So we could determine which communities would most benefit from improved access to clinical services or interventions that improved healthy pregnancies, healthy aging, healthy children, and vaccination. Geospatial analysis is coloring maps with data. A member of the public looks at a map, they can recognize their communities, they can recognize things around them, and then when we color those maps with data that tells a story about health status or the capacity of public health agencies to address community level needs, again, it allows people to use something that is familiar to them to draw important conclusions about ways in which we can become healthier as a community through investment in public health. The geospatial analysis allows us to be more precise and more efficient with available resources. It's a cliche that nearly everyone in public health knows that we need to look upstream before we can solve existing urgent acute problems in the present. So understanding the origins of health concerns allows us to be more specific about ways that we can reduce those concerns downstream. The analysis that we're doing now will not only present sort of the current picture of workforce needs for public health and clinical health at the community level, but because we've collected data over time and into the future, we'll be able to see the direct health impacts of variations in local public health capacity and in local safety net clinical capacity in terms of its effects on overall health status in the community. It should very quickly reveal the value of those investments through the health data, perhaps encourage more thoughtful, prevention-oriented policymaking. So we haven't got there yet, but this infrastructure allows us a data architecture and a geospatial analysis framework that will allow us to do really important longitudinal studies of health status and health risk at the community level. We should be able to correlate that with important vital statistics data, and most essentially to the public health infrastructure grant, the infrastructure of local public health agencies and the workforce in those communities that are there to address those needs. So for example, if we understand something about the public health workforce in a community that has high-risk pregnancies, we can invest in the education and expertise of that local workforce to really help them target their interventions and hire the right staff to meet those community level needs. Public health needs the investment to bring our technology and expertise to a par with what is available in the general private sector system. And the results that public health can generate with access to those resources will far surpass what we might see in the private sector. And the strategies available to reduce that gap are clear and in the evidence, and we simply need the tools to be able to invest strategically and precisely.